Hello everyone, it's been a while since I posted, but I came up with an idea for a very important topic, is that not everything that looks like ADHD is actually ADHD. ADHD, as we know, is very common, but there are many other conditions that are also common and they can manifest themselves in such a way that they can look like ADHD, but in fact they're not. Keep in mind that many of the conditions that I'm going to address can co-occur with ADHD. So that means you can have ADHD and another condition. But the video that we're going to devote today is going to address these conditions affecting individuals that don't have ADHD at all. They simply have these other conditions that make them look like they may have ADHD. So one of the most common condition that can look like ADHD is anxiety, which is extremely common in both children and adults. Anxiety can mimic ADHD because when someone is feeling anxious, when someone is devoting the majority of his or her own energy and time mired in worrying about things, feeling nervous, trying to think about what could go wrong, then it's hard for that person to pay attention to what's actually in front of him or her. And so that can look like ADHD because you're not really paying attention to your surroundings and it's hard for you to process information. And sometimes people can act impulsively because one form of anxiety is OCD, or obsessive compulsive disorder, and that will make people do things that seems illogical or irrational. They do things repetitively that can come across as being someone who's being impulsive or hyperactive, but in fact is the anxiety that's driving this behavior. Another condition that can look like ADHD is specific learning disorder. And in particular, academic achievement can be affected by ADHD, as we know. But specific learning disorder can also cause academic issues. One of the most common type of specific learning disorder is dyslexia, as we know. You probably heard of dyslexia before. And I just want to, without going too deeply into dyslexia, I want to clarify that dyslexia is not simply about the reversal of letters or symbols or having a hard time deciphering symbols. But dyslexia simply, in a broader sense, is having difficulty translating the written language into meaning that you can understand and comprehend. So, of course, if you have dyslexia, you're going to struggle in school. And if you have dyslexia and you can't really keep up with what's going on in class, you're going to fall behind. Not only that, but you're going to lose attention because when you can't really follow along, when you can't really understand the lesson, you're not really going to pay attention after a while because you don't really know what's going on. And in addition, if you can't really adhere to what everyone else is doing, then sometimes the best way to cover that up, that deficiency, is by acting out, which can look like ADHD also. It can look like hyperactivity or impulsivity, or you may be making fun of yourself or other people to distract their attention to the fact that you're not really able to learn material because your specific deficiency in the area of either reading or math. Another common thing to consider when we're evaluating for ADHD is hearing or vision problems. Of course, if you can't really hear what the teacher is saying or your peers are discussing in class, you're going to have a hard time following the discussion and understanding what's going on. And that can look like ADHD because it looks like, well, you're not really paying attention, but in fact, you really can't hear or see. So one of the first step in evaluating for ADHD is to make sure your child or yourself have good hearing and vision, and this could be done at a simple doctor's appointment. If you schedule a routine well exam, hearing and vision test is usually done as part of the appointment, so you can get that taken care of. If you want to do a more comprehensive vision exam, of course, you can always schedule an appointment with your local optometrist. Another condition where it might look like ADHD is if there's any underlying social or family issues, if there's domestic violence going on, or there's parental neglect, or there's marriage discord, or physical sexual abuse going on in the home setting. That can come across as ADHD because the person who is experiencing those difficulties can find it hard to pay attention to what's going on because there's so much that's taking up place in the back of the mind that it's hard to pay attention to the surroundings. Specifically, I have seen there was a mother who brought her teenage son to see me because he has just things scattered all over the floor in his room. He can't find his homework. He's disorganized. He have half-eaten pizza in his bed. And it turned out that he was simply messy and the mom is kind of a clean freak. So that's definitely not a good match. And that conflict often trigger friction in the family member and in the relationship between the parent and child. A specific kind of social issue in the school setting or maybe even at home is bullying. A lot of children are victims of bullying in the school setting. And some parents, they're desperate, so they eventually end up switching to a different classroom, switching to a different school. But oftentimes that doesn't really solve the problem because unfortunately bullies are everywhere. Bullies are born in every generation since the beginning of mankind. And bullies exist in every single school, in every setting. Good schools have bullies, bad schools have bullies, high-performing schools have bullies. Maybe it is manifested in a different way, but bullying is bullying. It generates tremendous amount of stress for the victim of bullying. So that's always something to explore. And finally, occasionally I do see that allergy problem can manifest itself as having symptoms that mimics ADHD symptoms. How does that happen? So if you have nasal allergy, that may make it hard for you to breathe through a patent nostrils because your nose is always stuffy. Or that might even lead to sleep apnea at night. So if you're not really getting quality sleep due to your allergy symptoms, you may have a hard time getting up in the morning. You may struggle to stay awake in the classroom. And of course, if you're half asleep in the classroom, you're not able to keep up with the lesson and understand what's going on. You may fall behind academically. That might interfere with your social life as well, because if you're just cranky from the lack of sleep, that could be an issue. Of course, simple sleep problem, meaning if you have a hard time falling asleep or you have early waking, that can interfere with your learning too, and that can come across as that you're incapable of controlling your attention because you're simply sleep deprived. So that's another area to explore, and that's something I routinely do during part of the intake when I evaluate a new patient with ADHD. So I hope that covers most of the things that may be mimicking ADHD symptoms but are actually not ADHD. And if you have any ideas or personal experience, please share in the comment below. And if you want me to address specific topics regarding your condition, definitely send me a message and let me know, and I'll be happy to generate a video just for you. Okay? Enjoy the rest of your week. Take care.